Well, we're now joined by Dr. Jane Philpott, the Dean of Health Sciences and Director of the School of Medicine at Queen's University, also a former minister in the Trudeau government. Dr. Philpott, thank you for joining us again.
My pleasure. Nice to be here.
Now, as you know, New Democrats say that any pharmacare bill put forward by the government has to be one that creates a public single-payer system. You know, the politics aside, you also say this is the kind of scheme that Canada needs to pursue. Why is that?
Well, this is something that's been studied over many, many years. And of course, we can also look to international comparisons as to how good pharmacare programs happen. So there's a lot of evidence out there. But I would point specifically to the report that was commissioned by the current government in its previous iteration and delivered by Dr. Eric Hoskins in 2019 that looked at the different kinds of models of care. And there was no question in the end that the best model for Canada to save money and make sure people get the medication they need is what we call a universal single payer system. And so I'm happy to see that there's a lot of push in that direction. And that's very much what many of us are hoping to see out of the government in the coming months.
Okay, let me pick up on that point, though, because Conservatives, we hear from them, they're concerned about the dollars. Pierre Poilievre saying that he would rather look at reducing program spending in general before creating new programs. And pharmacare would cost billions for the public purse. So what do you say to that kind of argument, that type of concern?
Well, I say this is exactly how you should be trying to save money for the public purse, because in the end, this will save money for Canadians. We already spend an enormous amount of money as Canadians, and including Canadian governments. Close to $40 billion a year gets spent on pharmaceutical medications. It's very costly. The incremental new cost to add a basic package of medications for universal single payer would be as little as a couple of $1 billion extra, is the news that we heard from the parliamentary budget officer. And in the end, that will save money. It'll save money for governments. It'll save money for people who have no drug plan, and it'll save a lot of money for both employers and companies that are providing these plans right now.
Now, would a public system affect private programs? Because right now, as you know, there are many Canadians who are happy to have the coverage that they currently already have.
Well, they're happy to have it because it's certainly better than no coverage. But at the end of the day, either that person or their employer is paying for that. If you look at even the overview of the Hoskins report that came out, one of the things that shocked me when I reread it recently was that not only do we have about 100 public drug plans across the country, we have about 100,000 private drug plans across the country. And people know how much administrative cost it is just to even fill out the forms to get your money back for that. But the other effect of all of those drug plans is that there's no bulk purchasing power. So what a universal single payer plan would allow us to do is to bring all of those together and say, hey, all Canadians need this particular medication. You need to give us the very best price possible. And the fact is that right now, Canadians are paying some of the highest drug prices in the world. So we'll all save money if we can get that unified bulk purchasing power together.
Okay, talk about potential negative effects, though, because as you know, healthcare minus pharmacare right now, that's a public program. There are shortages and long waits. Many people, millions of people still don't have primary care. Would those kinds of frustrations be created by a public pharmacare program, since people right now are looking at maybe private solutions to the public healthcare system?
Well, there is no question that there are a lot of challenges in health systems right now. But in fact, by getting things right on pharmacare, it may actually be the first step to solving some of those other big problems like access to primary care. In both cases, and this is often a phenomenon in healthcare, is that when you do the right thing and you spend money in the right places, you actually save money in the end. Instead, unfortunately, what we end up often doing, because we're not being proactive in our health, either as individuals or as a society, is that we end up spending a large amount of money for late stage care, for hospital care rather than for preventive care. And so making sure that people can have access to the medicines that they need, making sure that they have access to the primary care providers that they need, those are the smart ways to spend our money so that we can ultimately actually bring our costs down. And that has been documented in lots of countries, in Europe in particular, that pay a lot less than we do per person on healthcare, but get better outcomes and people live longer.
Okay, so if it's not a public single payer system that emerges from the Trudeau government, what's the alternative? What kind of program would cause you concern?
Well, the other alternative that's most frequently discussed is called a fill the gaps, and it's not dissimilar to the model that's being used now in Quebec, which means that most people that have private coverage continue with their private coverage, no matter how expensive it might happen to be, and the public steps in and fills those gaps for the people that don't have money otherwise. But it doesn't get at the real benefit of a public pharmacare plan, which is that ability to be able to purchase in bulk, to be able to get the lowest possible prices, and to be able to save all of that administrative cost. It's the system that's used for healthcare writ large in countries like the US, where we see just exorbitant costs that people are paying for healthcare because they've got multiple insurers, private and public mixture of insurers. In Canada, we've been able to save money because as it relates to the cost of doctors and hospitals, we do that with a universal single payer. Now we need to have the universal single payer when it comes to our pharmacare costs as well, and we'll save money.
Dr. Jane Philpott, always appreciate the time. Thank you for that.
Thanks for having me.